think we are ready to start our second session. I would really like to ask you all to be under the limit, 10 minutes, not to spend more time, because yesterday we have to leave the place at 2 o'clock because the people are having their break and they are coming back in the afternoon. And yesterday we were kind of late, so we don't want to repeat this. I would like to invite Camilla Guasti from ARCO to start our second panel with some of the main achievements of our projects. So for this second panel, we have invited partners that leaded some of the main activities of the project to present the achievements.
Thank you. Okay, good morning, everyone. Thank you for being here today. For those who don't know me, I'm Camilla Guasti from ARCO Research Center. We're partners of MedRiSSE project. We are a research center based in Italy, in a town near Florence, that just unfortunately was victim, let's say, of major flooding these days. So we're facing major difficulties right now, and hope my co-citizens will recover soon. What we do, we offer research, qualified consulting, and training services to all those organizations wanting to have an impact in society. We are basically operating in 5 strategic units. We work in different fields of, let's say, sustainable development. So we work in 5 units. Myself being a social economy researcher, we have colleagues working in inclusive development, others in local development. We have a unit focusing on circular innovation, circular economy, and a unit also working on monitoring and evaluation and impact evaluation. We work in Italy, but also extensively abroad. And as I mentioned, these are our units. I'll be brief because we have very little time today. But what we did for MedRiSSE, it's basically focusing on replication. So in order to replicate, first we need to understand and we need to capitalize. So being a research center, we were called to actually do an analysis, what we call a replication analysis. We did this in other projects also, but we did this more of for social economy organizations. This time it was interesting enough to do such an assessment within the framework of international projects. So we were called to study the good practices of the 5 capitalized projects within MedRiSSE project. You can see them here. So what we did, we extrapolated, we identified these good practices along with the partners of MedRiSSE, and we conducted a replication analysis. So let's start from the results. What we have now today, it's 5 roadmaps for replicability, 1 replication toolkit, and 6 learning videos. Now, why did we do that? Let's start from our end reader. So we did our study with having in mind who would be the readers of our outputs. And we targeted public servants, SSE practitioners, anyone interested in learning about good practices and giving a practical toolkit, let's say, practical information to understand the process, to understand the resources and the actors, and possibly to inspire, and even if not, incentivize others to do the same, or at least have an idea to do something similar in different contexts and territories, of course. So how did we do that? We started off, of course, like any other research, from desk analysis, so desk research on like evaluation frameworks. We built our own, also drawing from our previous experience. And then we, in a very quite long process, we called partners to share with us materials, documents. We carried out many interviews, more than one, because we were delving into the good practices more and more. So in the end, what we did is these 5 roadmaps, so one for each capitalized good practice. Instead of focusing more on the good practices themselves, allow me to spend more times on what will you find, so also to, as Samuel Barco did today, so you can go and read it for yourself. So let me just anticipate what you will find. The roadmaps are structured identically, okay? What will you find? So you have a presentation of the good practice, explaining why it is a good practice, the innovative feature, the added value. Then we reconstructed a theory of change, so that to make sure the consequent actors and activities that led to outputs and impacts. So let's say a schematic overview, of course. And then we destructured the good practices in 5 phases of the projects, starting from what we call the triggering factors, but in the positive way. So what we call the phase 0. So why did this good practice, how did it start and why? And then let's say the starting phase, and then implementation phase, and the possibly a sustainability phase. For each of these phases, we try to extrapolate and make sure who were the key actors, which were the key resources, and which were the key actions that were put in place for each of these phases. Again, why did we do this? Because we imagine someone who's not acquainted with the process and possibly would like to do the same thing or a similar good practice in their own context. So we needed to make sure each step of the way was clear enough for them to understand. Then there is a section that you will find for each of these roadmaps, which highlights which are the main risks. Personally, I think this is one of the most important sections of the roadmaps, because as you well know, being pretty much everyone implementers of projects, the risks and challenges are there in any good practice, especially in good practices that have to do with innovation and social innovation. And actually, even delving into this section could allow, possibly inspire other ideas for future projects and other intervention ideas on how to tackle such challenges. So this section is for the reader to understand, hey, if you want to replicate this, be aware that this is a challenge that we encountered, and this is how we overcome it. Or in some cases, not even an open question mark, but this is something that you can face. We then systematize these 5 roadmaps. So first we elaborate the 5 roadmaps. Then we systematize all this in what we call the toolkit, which is basically the 5 roadmaps together, anticipated by the methodological section, which explains how we did what we did. And again, we hope that we can, or others can also carry out similar types of analysis, because I think it's crucial when we talk about capitalization, as I mentioned earlier, to understand how to actually replicate something and what key lessons you can draw from what you just piloted. Now, this was actually, I don't know how many minutes I still have, but this was very quickly like a brief focus of the 5 good practices that we analyzed from each of the projects. So I'll go very quickly on that and invite you to read the roadmaps. So from Yes project, we actually delved into how the CITES pole in Mahdia, Tunis, was actually created, And so this is what Asma actually anticipated and talked about yesterday. So this common and collaborative territorial platform, which brings together different actors to actually provide a one-stop shop for SSE actors. Then in regards to RUOMED, and then followed up by 3 different cooperation projects with this GVA 17, 18, and 19, we actually delved into a public-private collaboration for comprehensive support to rural value chain and women empowerment. This is the Consume Palestine strategy, a capacity building strategy, which we analyzed and which you can find also as one of our roadmaps. And this is a very interesting case of a well-integrated, so public-private, comprehensive support to boost the rural value chain, which encompasses the demand side and supply side, which is also a hard intervention and soft intervention kind of initiative, having as key and core element women empowerment of these rural value chains and cooperatives in Palestine. As for More Than a Job, what we analyzed is the sub-grant mechanism, which in fact was put in place, which as an incentive mechanism to actually bring public sector actors, and particularly public authorities, together with SSE actors to work together in regards of providing support services for unemployed people. So this is another example of how you can actually come up with an incentive mechanism to put these 2 actors together to work and collaborate. As for MedUp, which is another project that we analyzed, we went and deep dived into a particular practice that was experimented within the project, which is the peer-to-grow, coach-to-grow capacity building strategy. Another interesting way of and triangulated service and capacity building strategy to have social enterprise support organizations and social enterprise working together to actually come up with a scale-up and long-term business development plan. And so in this case, again, we analyzed in deep how this strategy worked and all the other sections of the roadmaps which I highlighted before. As for MedTown, we analyzed the local and digital complementary currency model that was piloted in Cerro Mate district. So basically, which tested or which designed this system to actually provide, to actually test on the ground public-private co-production approach. Which entailed experimenting a currency model, a digital currency model, and to improve public services. And through all this, through a digital payment solution. So again, we had the chance to delve into the entire process, how the mechanism worked, who were the actors engaged, and again, all the challenges that they encountered, which is exactly what kind of learnings we need to treasure for future, hopefully future initiatives that will experiment some similar innovative solutions. So I will conclude. Our last outputs were the 6 learning videos. Again, this is me trying to be serious with my colleague Barbara, who's here with us, who worked with me. Not easy, but we did it. The learning videos are very like a quick summary to help us disseminate our work and hopefully have people to read these roadmaps and draw lessons, inspirations to actually try, again, to test these practices either in their, even beyond project operations, even in their maybe local municipality innovative programs, hopefully. So basically, this is what we did for MedRiSSE. You can find all this in the Social Innovation Lab. So all the materials is there, the toolkit, the roadmaps, and the videos. So we're very much inviting you to go and peek. If you have any questions, of course, I'll be here with you the whole day. So I'll be happy to answer any questions on our work. And thank you. Hopefully.
Thank you very much, Yumana.
Yes. As you have worked with different analyzing projects funded by different programs, not only NECBC Med, do you have other example in mind about the subgrant mechanism or something similar?
Thank you. You mean, do I have something else in mind of other kind? Mm-hmm. Yes, we have been evaluators of different projects, and we are also, for example, we are also partners in another NECBC Med project, which is Circles, which also include a sub-granting mechanism. So indeed, we have experience of different sub-granting design. In this case, the More Than a Job sub-granting mechanism, what was interesting is that the sub-granting design was actually used as an incentive mechanism. So to apply, you had to be you have to sign an MOU with a public institution. So this is how you can actually integrate within a classical, let's say, financial mechanism. You can integrate and incentivize collaboration between SSE actors and public institutions. Any other question? I'll be happy to answer.
Okay, thank you very much, Camilla, from this thorough analysis that you provided within the replication toolkit. I think it was the first material that partners have started to share, and it formed the basis for many activities that we carry out later on within the lifetime of the project, including the webinars that were organized by our Palestinian partner, the An-Najah University, that couldn't be with us here today, but we have a video to show they wanted to share with us.
Good afternoon, dear attendants. I am Imad Ibrik, the Director of the Technology Transfer Office at An-Najah University in Palestine. It's our pleasure to be with you today, even though it's an online format, to celebrate the final conference of MedRiSSE and Midtown projects. Unfortunately, due to the circumstances here in Palestine, we couldn't travel and participate in person in your event. My colleague Fadia and Dr. Samah will present the outcomes of implemented webinars through the MedRiSSE project, including objectives of these webinars, lesson learned, outcomes, conclusions, and some recommendations. We appreciate the opportunity to be part of this event with you and hope that this conference will prove to be fruitful and informative for all participants. With my regards, and now Fadia will start presenting the objectives of the webinars.
Thank you, Dr. Imad, and thank you all. Please, Dr. Samah, you can share the screen. Thank you all for joining us today to share the outcomes of our webinars that have been implemented within our project MedRiSSE. And as Dr. Imad says, despite the challenges that we have faced due to our current condition in Palestine, and as we cannot gather with you in person, but our commitment to sharing knowledge and fostering connections and making positive impact remains exist. Okay, next slide, please, Dr. Samah. The series of our 10 webinars for networking and learning that have An-Najah National University been implemented for fostering collaboration and disseminating knowledge and breaking down barriers to co-production between social and solidarity economy and public administrators, actors in the Mediterranean region. In this presentation, we will share with you what we have learned and what we can still learn and what knowledge can we share with each other. Next, please, Dr. Samah. Next, please. Through our MedRiSSE webinars, the target reached till now about 488 participants with an interest in social innovation and public sector innovative have been reached from SSE and academic researchers, approximately 79%, and from the public administrators and ministries, we have 21% approximately. Partners in MedRiSSE project and participants with an interest in social innovation and public sector innovation, researchers, NGOs, workers, and SDE actors, public administrator actors, cooperative, and students. All these are our stakeholders, and they have participated in our webinars. Next, please, Doctor. Here we will have a brief description about the implemented webinars. As you know, as you see on this slide, we have 10 webinars. 9 of them have been implemented, and the 10th one will be implemented by the end of this month. Next, please. And now we will give you a short highlighting on some special webinars that have a high interaction. I will give the floor to Dr. Samah, our expert in social innovation and social solidarity economy, to show you some details about these webinars.
Thank you, Fadia. Thank you for giving us the opportunity to be with you online. So I'm gonna share with you some ideas and thoughts about the different webinars or some of the webinars that we have implemented. We chose 3 of them, so we give you a space to understand how it was happening. So one of the webinars was around the empowering women through women's cooperative. We had almost 50 participants. In this webinar, we have a different contribution and exchange experiences from 5 women's cooperative in different contexts in the countries that are involved in the MedRiSSE project. So each one have presented her or a cooperative and talk about the challenges and difficulties they have faced while they are doing their work as women. So it was kind of different, varied cooperative. We have something related to economic, something related to social and environmental. In this webinar was really interesting because we have learned from each other. Different contexts have exchanged and learned from each other. For example, some contexts, they didn't know that there is something related to environmental cooperatives, so it grabbed their attention and their idea and gave them ideas about such cooperatives. So this was really enhancing to think outside of the box in some contexts. And also we have learned the commonality among the different cooperatives, women cooperatives, and the challenges they have faced as women leading such activities. And also we have another one which was around innovation currencies in the Mediterranean, and this was a learning experience for all participants, because in some contexts it's new or it's not existing. So this gave insight of ways and methods to fight poverty. And it was a kind of interesting discussion to see the role of the different actors in such innovation, such as the BAs and SSEs and the different stakeholders who have played important role in this success experiences. And we had in this webinar, we have a case study or a case example from PARC, who have shared with us their experience about the click coin system and the challenges they have faced to implement it in Palestine, and how they maneuver and to discuss the challenges and find ways to make it work in one of the villages. So also it was important on those webinars to distribute the ideas and the different ideas of the activities of MedRiSSE project. So we have highlighted something related to the e-courses that we have publicized it, so people can learn about these courses, and they learn about the process, goals, and ideas of the different courses that are existed on the MedRiSSE e-learning courses. So this is kind of insight for people that they can learn while they are in their homes or areas about the different topics. So the important thing for us was to think what after with all the MedRiSSE project and how we can keep the sustainability of this project. It's important here to highlight the recommendations and ideas of the webinar. So I am gonna tell you some of the recommendation, and then from this recommendation, we can think about process. I will leave you with some asked question to think about process of keeping this discussion. So one of the recommendation was the need to create advocacy strategy among the different partners, using the experience in some countries to influence the government to issue a law or regulation or policies that encourage social innovation project and to provide the support. Inclusion of marginalized populations, such as people with disabilities, women, elderly, other people. The participants always engage in a debate about the level of inclusion, what intervention needs have to be done to include them. Partners and participants agreed on the need to have structured discussion about the SSEs and to conduct more webinars and to have more space to exchange experiences in the different contexts, because in this way we learn from each other. Bring actors from different sectors to be involved in policies related to social solidarity economy, and also to highlight social solidarity economy success stories, which we have done in these webinars, and that gave people more insight to understand the different kind of economy, the different intervention of social solidarity economy, and the social innovation, of course. Inform and educate targeted population about the principles of social solidarity economy and its approach and goal, trying to find a legal framework that define what are SSE's actors and to define what is the social solidarity economy. And I think it's important to say that through these webinars was opportunity in some contexts, especially in Palestine, which we are based on. We have the opportunity to make people to start building networks among the private sector and the public sector and the different SSEs to work together and to also think about policies of how they can support ideas related to social solidarity economy. So it's important for us was to engage stakeholders, and maybe in the future it's important to have their contribution and existence and appearance on such webinars. We thought these webinars were opportunity for everybody to learn from each other and to exchange experiences, and also to think about action to conduct with each other. We think that in the future, these webinars exist online, so people can access easily. And for example, because we are a university, we can use them in our courses, and we can encourage our students to learn from these contexts. And of course, we hope to keep the discussion going. Thank you for the opportunity, and hopefully we meet with you in the future in person, and hopefully the war will stop soon and people can go back to their normal life. Thank you.
Thank you,
Thank you.
Dr. Thank you,
Thank
Fadia.
you. Bye-bye. Thank you.
Bye-bye. Bye.
Bye. Bye.
Well, yes, these webinars were really important, first of all, for us, the organizations of the partnership of the project, because we had the chance, 9 so far, they are organized to learn each other, as it was already mentioned, but also invite local stakeholders and participate and show our work and what we have done and we have shared so far, including the replication toolkits, the e-learning courses. It was also a tool to disseminate all the collective work that we have done within this project, including the platform and the widened community of practice. And now I would like to make a very, very brief and short presentation about the digital tools that we have developed through our project. One of the activities that we were leading together with the other Palestinian partner, PARC, that unfortunately they didn't even have the time to prepare a video because PARC is dealing with humanitarian assistance in the Gaza Strip. They have their branch offices there and they colleagues, and I mean, they have to deal with more urgency issues. We'll start from the community of practice. One of the main activities, capitalized activities of the MedRiSSE project is the widening of the community of practice, which means to widen our community and our knowledge within 4 new projects, 4 Mediterranean cooperation projects that were funded under the European Neighborhood Policy. One of the activities that we led was the Work Package 3. That has what we wanted to do here, as I said, was to widen the community of practice, the knowledge and the lessons learned from these 5 projects and make a bigger community. For that, we had the help again of Red de Transición, Spanish association that worked with all our partners in a collective manner to concentrate all the valuable information and training material of the 5 projects and organize all this information and the training into this digital platform and tools. So we are very happy because this community has, in reality, gained in the number of users and of people that are getting access to there. And we are very happy because we also developed a wiki of our project, a MedRiSSE, where we can find all the material that we have produced. Somebody can navigate and download the PDF documents. Also, from the knowledge of the 5 capitalized projects, we developed e-learning courses. Oh, I'm sorry. Here you can see the wiki and the structure. We have worked, it wasn't difficult, it wasn't an easy task to to find a common structure to put in place the work done from 5 diverse projects. But this is a tool that we can still develop and evolve in the future. There's also a manual, a handbook, when each organization or user can read and learn how to upload content on that platform that are relative with the fields that we are working. We also produce, and we use a lot of the material of the replication toolkits to develop 5 e-learning courses on the thematics that we are working, where being a member, a user of the platform, you can have access to these models, and then you can have a certificate of achievement of the course after a small puzzle of questions that you can you will answer. Also for that, we have produced some small videos where in it, before you attend the course, you can learn what the course is about, and now we are actually translating both the e-learning courses and the replication toolkits in Arabic and Spanish, because we saw that the main obstacle to what we are developing is the language. So in every project, I think it should be, from the beginning, it should be budgeted some translation costs, because all this material is very useful also for the young people, but many times the language is an obstacle. Here is the platform, the Whiten Community of Practice. So we tried to, we improved the first version that we had developed through the Midtown project, and we made it more interactive. And we still encourage our partners and friends to have some activity in the community wall and share their experience as a platform and events. And now I think that I will invite José to make a small presentation of the Med Policy Lab that we have developed together with PARC. If you can give us a sort of elements about the Policy Lab.
A number of us were discussing over coffee. The Med Policy Lab, it's an evolution, like an added layer to what we have built until now in terms of all of the components that were described by Georgia right now. Basically, it's a new house that we need to inhabit. It's something that's more potentiality than reality. It's an idea of how to continue with the work of this project and launch it into the future. The idea would not be that the website, the platform that we created, just holds some content that was produced during 2023 and ends there in the landfill of all the websites of the projects, European projects that are often ending like that. So that we take a platform that has all of the potential to become a cooperative platform. And Victor Messager was mentioning before the importance of advancing into platform cooperatives. Develop the idea that it's already there in the program, in the platform, of how the linkages that we are creating through the network of relationships that we're building through the interactions here go a step farther, and we move from linkages to mutual support, and from mutual support to providing services to each other. This is crucial to the concept of social economy, intercooperation. So the idea will be that we thanks to the technology that we have developed in the platform that allows us to exchange tokens as a sort of currency that allows us to, to have exchanges like a time bank at the moment, that we in the future had a social market where organizations, enterprises that provide ethical services to social and solidarity economy in their countries could have a platform to provide further services in other countries. So this is one thing, internationalization and the social market. The other thing has to do with fulfilling the role of a laboratory. So finding ways to continue the role of experimentation, research, and knowledge platform, shared knowledge platform. In order to do this, well, let's not pretend otherwise. We need to fund such an activity. That means we need to find ways to continue financing the activity of a laboratory that could carry out this sort of testing, of new models, researching, and even providing consultancy to other initiatives. So in order to do this, one of the discussions that we need to maintain over the next couple of days is what are we willing to do as a partnership to share the governance of this platform? How ambitious do we want to be together? How much are we willing to invest into its promotion? And well, the only thing I can say there is that I mentioned it before. We have, as ACPP, we have already sought funding so that we could, at the very least, dynamize the interactions for the platform over the next year. And we are waiting still to hear from the donors. It's likely that one or two of the proposals will get funded. That means that we could hopefully ensure that exchanges, interactions will be promoted over the next period. But I've mentioned a lot more than that. Research, testing, experimentation, the social market, all of those elements are there. Any other that we can envision together. So that's basically the idea of the laboratory.
Thank you, José. You explain it better than anyone. Now I would like to invite our colleague from JOHUD.
Yeah, our initiative and the project of the MedRiSSE somehow is complementary to what we have achieved within the Midtown, and how to reflect it over the platform have been initiated. Next slide, please. We have organized the first National Strategic Stakeholder Dialogue event. This was last February with 55 participants from community-based organizations, CBOs, governmental entities, Ministry of Digital and Economy, entrepreneurship, business incubators, and individual entrepreneurs joined this event in addition to MedRiSSE project partners. This was to introduce the MedRiSSE project. Role of JOHUD is in Midtown and MedUp projects, and the MedRiSSE project as well. The MedRiSSE project toolkit briefing has been introduced, in addition to assessing social innovation practices in Jordan, include challenges and successes of capitalization projects, thematic areas, through roundtables discussions. The thematic area discussed in the roundtables was include circular economy, social and solidarity economy, social entrepreneurship, sustainable projects, co-production, green economy. The roundtables were facilitated by a JOHUD team and one of the experts from Oxfam, specialized in a social enterprise development advisor. in addition to, this was to conclude collective understanding of concept definitions, misconceptions, pros and cons, addition and challenges. These materials was shared and knowledge in the widened community of practice as well through co-production. The material, and it was uploaded, the knowledge gained from Midtown and MedUp projects. It was included both languages, Arabic and English, sharing of project information, concept definitions, in multi-online exchange events also, contributed in elaboration of comparative report analysis on co-production and public sector innovation. Collaborated with Oxfam Italy also to produce promoting the role of social and solidarity economy in developing the green economy in Jordan policy brief. Topic selections, it was based on the National Strategic Stakeholder Dialogue, event roundtable conclusions, data collection is the key informant, interview and research. Okay. This was also intended to supply basic reference and a starting point, a roadmap that would back JOHUD's advocacy in terms of supporting the development of Jordan's green economy. The idea we have focused on two complementary approaches in Jordan of the green economy, which are the supporting the entrepreneurial ecosystem as a whole and social entrepreneurship in particular, B, enhancing the role of social and solidarity economy agent as active partner of the public and the private sector in promoting green initiatives. Then calls of urgent policy intervention to support the green transition and highlights the key parts of that can be played by social and solidarity economy players in catalyzing policy change and supporting multi-stakeholder cooperation. Structure of this was overviewing of the context, needs and challenges, promoting the green economy, recommendations and asks. These are the coming activities within the coming 2 weeks. We are planning to organize around 12 national awareness events. This is to enhance the public awareness and disseminating information about the value of cooperation, sharing material and knowledge. This was, of course, through the educational platform, widened COP, which is linked to Mediterranean co-production lab. Thank you, Yani, for just sharing this information about what you have talked about. José talked about the lab, and you have talked about widening the community of practice. This is an important, I think, topics, these two, to include and to have the participation of the organizations as well as stakeholders and beneficiaries, widening and increase the benefits of the projects. Thank you again.
Thank you very much. Very quickly, I will, yeah, Jumana.
As Samuel Barco said yesterday, that one of the conclusions is to better adapt to the local context. I will ask a question to the Jordanian partner. What is the general feeling when you address public, private stakeholders of the different sectors you mentioned, when you talk about co-production, social innovation? I mean, I'm curious to know the feedback and how, to which extent these concepts are understood in the Jordanian context.
Thank you, Jumana. And this question, I would consider it quite a question, and also it includes, I myself, I would like to focus on one thing: the coordination, the collaboration between private sector, public sector, and relevant stakeholders in general. Still in Jordan, we still have some gaps we have to work on because of one thing, that each sector somehow work independent from another sector. So the coordination, the collaboration, the feeling of the ownership from the governmental body, from the private sector companies, is not within the spirit we are looking for, is not understood properly as we are looking for and what we are aiming for. Of course, this is not due to the misunderstanding, rather than due to a lot of challenges faced, either if we are considered the sector of the governmental policies and the governmental implementation plan, they have their own priorities. By developing the country, by developing strategies, but they are not focusing on how to implement these policies on the ground by including local CBOs, local NGOs, local private companies. So there is still something to work on this context. I don't know. Okay, you can.
I have the feeling, I might be wrong, that there's still a huge gap between the needs of citizens and local communities, the national priorities. Are they really national priorities, or are they just directed by international funding bodies? I mean, just to set an example, we talk about green economy. In a European context, it's something totally assumed, understood, and assumed by the governments and different stakeholders. But talking about green economy in Jordan, sincerely, I think it's it's like far, far away from the European context. So how do you match to make sense? Because by the end of the day, the idea is to improve people's life. So how you make sense between the needs of local communities and match it with what international funders would like, with their nice words of green economy, of social innovation, of blah, 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 and how the government can interfere and connect between these. I mean, it's not only for you, it's a wide question.
Thank you for this question. First, I would disagree with you in terms of the big gap between the community and the individuals. No, within the community, there isn't that much gap. I'm talking on behalf of the community. I'm presenting a local community. So in our organization, we know very well the needs of the individuals within the community, whether it's an urban, rural areas, regardless. So in terms of the needs, in terms of the determining the priorities, it's well known for us. I will talk to the other part, which is the national strategies, the national priorities, which is drawn by the international agencies, okay? But let's face a fact. I'm not saying any secrets or any hidden information when I'm saying that even the international agencies, they are following our governmental high strategy, priorities. When the king came and say, now our priority is food security and climate change, everybody will come behind him and will talk about the same priority. When the king say something else some years ago, all the international agencies goes behind what he is saying, and they are trying to design projects about what the priorities he said. This is a fact, okay? Regardless of the international strategies and priorities. I would say our own experience. I myself, I was leading JOHUD's program, Natural Resource Management Program, since 2010. In 2012, I approached a lot of international agencies and donors talking about green economy, specific about green economy and its impact on the community and its needs for us as Jordanian. Jordan was the third poorest country in water at that time. Okay, now it's the second poorest country in water. Okay, so frankly speaking, our top priority is water. Water leads to agriculture and food security and other things. But in 2012, nobody was listening to what I'm saying. Sorry to say that. Now, everybody is talking about the same terminologies I have used 10 years ago. So, with all the respect of the strategies at the international and the national and even at the local, but on the ground, what's implemented is something different from all the levels. Sorry for being that frank.
It's okay. Thank you very much. I think in all the countries it was challenging to work with the concept of co-production and social innovation, collaborate with the public sector. Even here in Spain we had troubles, and from Samuel's report it comes out the conclusion that the public authority needs to be more flexible to be able to absorb and collaborate with SSE actors and implement social innovation. So I imagine that something like that in the context of Jordan is even more challenging.